I want to join my welcome to Adams. You can see that we're trying to do things a little bit differently this year because many of us are pretty over webinars. We're kind of pretty webinared out after 2 years of COVID. So we're just trying to take, we've got our short and sweet series where we're trying to make these short, watchable, manageable without taking up too much of your time. And I think Adam sent out our program for the year. If there's anything you'd particularly be interested in, we're happy to hear from you. But today, this is really very much our introduction to compression. So compression 101, how to prescribe a garment. So let's get started without further ado. So this is a very basic webinar. It is meant to give a good workable overview for you. And if you have any questions, please pop them in the group chat, and then Veronica is going to sort of relay those questions through. So actually, I've shut my office door now so I can take my face mask off. So we're going to consider, when does compression help and how does it help, and whether there's extra considerations to bear in mind. Brief overview of what is graduated compression, and then what do you need to consider when you're actually prescribing a garment. So when does compression help? I think a lot of this will be very familiar to you, but in the sort of as an overall concept, you could say, we use compression to help with a range of vascular conditions, which include varicose veins, venous leg ulcers, DVTs, certainly for lymphedema in a wide variety of forms. The family of edema, so that's dependent edema, traumatic edema, and palliative care. We use compression for scar management, and most notably hypertrophic scarring and keloid scarring. We use compression for postural support and correction, and also for sensory stimulation. So exactly how does compression help? There's a range of mechanisms that compression employs in order to do the job properly. So, and these don't apply to every garment that you're going to put on. So it depends the purpose that you're using the garment. It reduces excess interstitial fluid. So in the edema, it helps to move some of that fluid away. It encourages the reabsorption of that fluid to reduce the edema. It reduces the dilation of veins and improves valve function, venous valve function. It enhances the muscle pump, and we'll talk a little bit more about that. It increases the rate of the fluid flow in veins. And most critically, it supports fluid flow going from distal to proximal. It closes capillaries and scars to reduce the fibroblast activity, which ultimately is the mechanism that will address hypertrophic scarring. It also reorientates collagen fibres. Collagen fibres are sort of the culprits in hypertrophic scarring, and that consistent compression helps to reorient the fibres. Compression helps mechanically by, if the garment is designed in order to achieve this, to correct posture, to provide support, and to provide sensory stimulation. So let's go back to that little bit about the veins and the valves. So this is a very, this is basic information, but oftentimes what I find is that when compression is a new field, it's some of these things we don't necessarily think through or bear in mind as the underlying information that informs our practice. So valves in the veins allow unidirectional flow, and particularly when we consider the lower limbs that are working against gravity, we don't want backflow. So it's the valves, a little bit like the lock system that you see in the canals in the United Kingdom. It stops the fluid going back the other way. And in healthy legs, muscle activation, so walking causes the valves to open. Walking is one, but there's a range of muscles that are involved, obviously. And then during muscle relaxation, the valves close to stop the backflow. This is the muscular activity around the vein walls. But when veins are damaged or aging, fatiguing, so damage can come from varicosis or thrombosis, and then as people age, the valves become inefficient. You can see that illustration on the right. The valves sort of end up flapping in the middle, and so their function is compromised. So bear that in mind. Well, actually, I might just skip back. So when we compress with a compression stocking, we are actually closing down the veins so that the valves are able to meet in the middle, so it improves the valve function. And then broad picture for a vascular and lymphatic system. I've left this slide as it's one that we've used for a number of years, but we used to believe that 90% of the fluid that comes out from the blood capillaries is reabsorbed, and it's only the excess 10% that's picked up by the lymphatics. Recent evidence is suggesting that it's a far, far greater figure than that's picked up by the lymphatics. And for those of you who are less familiar with the lymphatic system, the lymphatic system is a one-way system, whereas your blood circulation leaves the heart, goes to the tissues, comes back. It's a closed circuit. Lymphatics are one way. They start in the tissues as blind end vessels. And there are anchoring filaments that attach to the cells of the lymphatics that actually, through movement and a range of complex functions, those filaments tug on the cells to open the gap between them, and so the lymphatic fluid is able to move into the lymphatic vessels to begin its journey away from the tissues. So let's talk a little bit about the difference between edema and lymphedema. So simply put, when the volume of lymphatic fluid exceeds the transport capacity, edema develops. So too much fluid is edema, and it's a little bit like peak hour traffic. When the traffic, the number of cars is very high, then we have this congestion. But as the fluid moves and, you know, the day goes on, peak hours over, things just move as they normally would. Now, lymphedema is when the actual transport system is impacted. So it's a little bit like on the freeway. If they were to close a couple of lanes, even in the middle of the day, there's not a huge number of cars, but there is congestion that develops because the road is not up to dealing with the relatively small amount of cars. This is not the time and the place for going through this long unpacking of this, but it is useful to bear in mind that there are two types of lymphedema, primary versus secondary. Essentially, primary is a congenital interruption to the transport system, whereas secondary is an acquired one. So oftentimes after cancer surgery, trauma, or some kind of mechanical interruption to the system. Bear in mind that you can have a bit of both. You can have lymphedema with acute edema, in which case we sometimes call that a mixed edema. So I did say we're going to talk a little bit more about the muscle pump, and this is looking at how compression enhances the function of the muscle pump, which we refer to as one of those things on the list. So when using the calf muscle as an example, when you walk and your calf muscle tenses, it bulges and it pushes against the veins, and that encourages fluid flow. When we put compression on the outside, we then get this, it's not quite right to say equal and opposite, but we get this opposing force coming from the outside, so that when the calf muscle bulges, we get a greater effect because there's a pushback from the external surface where the compression garment is. It's the resistance from the stocking that helps the muscle pump's effectiveness to be improved. Now, what do we need to consider when we are prescribing a garment? As a very basic screen, we need to consider whether someone is fit for compression. And one thing that I'd say Veronica and I would both say is that we observe is that particularly working in the areas of scar management, where we have got a very clear focus of the benefit and the need for compression, sometimes some of these other functions or precautions can be overlooked. So it's important, regardless of the reason for compression, that we do a basic screen for a fitness for compression. So the more absolute contraindications is if somebody has congestive cardiac failure, if they have severe arterial insufficiency, and we would measure that by them having an ankle brachiopressure index measure of less than 0.5. And then if people have infections or exudative dermatitis or very bulky dressings, it's just not appropriate. Precautions, and so you might need to go back to whoever holds the medical governance for your patient or do further screening. If they have poor cardiac function or unstable cardiac conditions, I myself would always check with the GP or whichever medico holds the governance that they are fit for compression. If they have an ABPI of between 0.5 and 0.8, they can have compression, but it's generally wiser to reduce the level of compression. Then a few other conditions: renal insufficiency. If they have extreme shape distortions and deep skin folds, it's not that they're not suitable for compression, but we very much have to review the type of garment that they would wear. Lymphorrhea, severe peripheral neuropathy, pulmonary edema, and fragile scarring. I'm sure that they're conditions that would be very familiar to you. Let's talk a little bit about graduated compression. It's highest at the ankle and it decreases up the leg. And obviously that is to support distal to proximal flow. And it also supports the vein wall and helps the calf muscle to pump blood and lymphatic fluid back towards the heart. Because we're keeping our webinar short and sweet, I'm not going to go into a longer explanation about how graduated compression is achieved. But for those of you who work with serial compression bandaging, you will know that as you bandage with equal constant tension, that automatically reduces the level of compression as the circumference in a limb gets bigger. So obviously a thigh is bigger than a calf and a calf is bigger than an ankle, and so that will achieve graduated compression. But all garments that a patient wears for medical purposes should have graduated compression. Just a little aside about compression classes, because depending on what clinical area you work on, you might refer to garments as having 20, 30, 40 millimeters of mercury, or you might use the terminology of class 1, 2 and 3. At Jobskin, what we would say is that be cautious in using the class system, because for a couple of reasons. One is there is no Australian standard for that, and also it isn't a universal classification. If you look at some of the packaging, the French, German and European garments use different scales. So what they define as class 1, 2 or 3 can differ. When you use millimeters of mercury, we always know exactly what class compression that you are applying. So from our point of view, we say that's a preferred descriptor, but we also recognise that some clinicians do use the class 1, 2 or 3. Right, so how much compression when? Generally 15 to 20 millimeters of mercury. This is like travel stockings or lightweight stockings. We generally use for tired, aching legs, for travel obviously, mild edema, minor varicosis and some varicosis during pregnancy. 20 to 30 is probably the most common class of compression, and it's used for scar management, tired, aching legs, moderate to severe varicosis. It's used after sclerotherapy. used for moderate edema and also used for the prevention of the recurrence of venous leg ulcers. 30 to 40, severe varicose veins, lymphatic edema also can be used after sclerotherapy for the treatment of venous leg ulcers rather than the prevention, and used for moderate to severe edema. Now, they are the levels of compression that are available in ready-to-wear garments. When you have a custom garment, the compression range is greater. So, for example, Jobskin garments can be manufactured up to 70 millimeters of mercury. That's a fairly extreme level of compression. And our rule of thumb is that we don't move up a class of compression until the previous compression is failing, other than the guidelines that you can see on your screen here. A bit about how a garment is constructed, because this is really probably the most critical thing with prescribing a garment, because how a garment is made influences your prescription. So a standard off-the-shelf garment, the sort that someone might purchase in a chemist, is made as a circular knit garment. Those of you who remember French knitting at school will remember that when you wrapped the wool around the spool, if it was tight, the tube was skinny. If it was loose, the tube was wide. And that, most simply put, is how a circular knit garment is constructed. But what you have to be aware of, most significantly, if you were to cut that garment, that fabric curls. And that's a red flag for us when somebody is at risk of, potential tourniquet. So if somebody has a very lobular shape to their, say, leg or their arm, particularly wrists and ankles and knees, then they are at risk of the garment cutting in and interfering with the supply. So if somebody is in that position, they cannot be put in a circular knit garment. At the other end of the spectrum, there is a flat knit garment. These are knitted and they are heavyweight. They are a much stiffer garment, and so they hold their shape and they can ride over creases in the skin. So they are safe for somebody who has that lobular appearance to their limb, or where they have that very marked anterior ankle crease or crease at the wrist. In between those sort of two ends of the spectrum, you could say, of garment construction, there are the cut and sew garments, of which Jobskin, all of Jobskin custom garments would fall into this category. The beauty of Jobskin is that you can choose the level of compression. They are cut and sewn to a patient's specific dimension. They have many options and modifications. But again, if somebody has a very, very marked lobular appearance, to have a cut and sew garment, there'd be a couple of other modifications that would need to be made. So you need to take that into account when you're prescribing your garments. And we're happy to do a webinar a little bit later that gives you a little bit more information about this, because, as I say, we're trying to keep this short and sweet. So one other factor when you're prescribing a garment is, are you going to do something that's individualised and custom made, or are you going to take a box off the shelf? In essence, custom made is essential when a patient doesn't fit a ready-to-wear garment. So when you consider the principles of graduated compression and all of those other goals that compression is attempting to achieve, a person must fit the parameters of ready-to-wear sizing. It's not like going and buying a pair of jeans when you're a 14 on your hips and a 10 on your waist. So you go, oh, I'll wear a 12 because I can squeeze a bit of my hips, and if it's a bit big on my waist, it's okay. Because if something is too loose around the ankle and tight around the calf, you are actually going to force the fluid flow proximal to distal. So that's the first thing. So they have to fit ready-to-wear garments in terms of circumference, in terms of height or length, limb length, and the proportion. Custom made is also essential when the patient's an odd shape, and that stands to reason if they don't fit ready-to-wear sizing parameters. Where you need a really accurate fit or compression, and this is particularly so for the torso because ready-to-wear options are limited. And so, for example, if you're trying to address breast edema or breast scarring or mastectomy for one breast and not the other, it's very difficult to get a therapeutically effective garment. You may need to go into custom made when you want higher levels of compression or when a suitable style is not available, or where you need a range of design options and modifications to help with donning and doffing, to help with compliance, maybe to accommodate skin fragility. There's a whole lot of reasons for that. Just one little sort of an aside when we're talking about ready-to-wear gloves. If you haven't seen the Jobskin ready-to-wear gloves, we'd be very happy to pop a brochure in the post to you. Something funny's happened with my layout of the sizing chart there. I'm not quite sure what happened, but we can provide you with a more accurate and correct sizing chart there. Just a bit about Jobskin custom-made garments. They can be made for anywhere on the body, and we use varying weights and types of fabric. We do encourage you as the therapist to collaborate with Veronica and I as the clinical advisors and also as a designer so that you can get the garment that you're looking for. There are a huge range of options and modifications that allow you to get an accurate fit, to make it easier to put garments on and off, to accommodate patient preferences. They can choose their colour and the style to some degree. We can vary the levels of compression within a single garment. We can target compression in specific areas. We can include linings to protect fragile skin. We can accommodate silicone products or dressings when they're required. And overall, we can do whatever it takes to help improve a patient's compliance. So what exactly is the art of prescribing a garment? You need to consider the basis of the need for compression that we spoke about at the start. Then you need to identify the most appropriate construction method, consider where there's a suitable ready-to-wear garment, and then if not, if you're going for custom made, you need to itemise and consider all the aspects that need to be factored into the garment design features. Now we've got some printed material that these three brochures are all designed to help you prescribe a garment well. On the left, there's the garment selection modifications, which basically has a picture of every option and modification that's available in a Jobskin garment. But then the other two brochures you can read there, they're both called Making a Good Garment Great, but one looks specifically at burns and scarring. The other looks at the family of edemas and lymphedema. And they are kind of, it's like a flowchart system that helps you, by process of elimination, work out exactly everything that you need to take into account to prescribe. They are available on the Jobskin website, which is www.jobskin.com, and it's under the resources tab. But we are also very happy to pop the hard copies of those in the post, because depending on the limits of your poster, it's an A3 size document that's folded in half, so it looks like an A4 brochure. But we're happy to post them to you, and if you would like us to send you that information, then pop your name in the group chat and we'll be in contact with you to get the best postal address. Thank you for joining us for our first short and sweet webinar. We've managed to keep that to 20 minutes, and I apologise, the date for the second series, we had to have some changes, and so today we've done our short and sweet number 1, Compression 101, and tomorrow we're looking at how you can how you measure the Jobskin way, because we provide you with paper tapes that make measuring the limb very simple and accurate and effective. So we're doing that tomorrow. It's 1 o'clock WA time to, oh, something's not right there in the conversion. It's 12 WA time, it's 2 p.m. Eastern Standard Time, and it's 4 p.m. New Zealand time. So we'd love to have you join us. Just a reminder, those resources can be found at jobskin.com under the support and training and the resources tab. Veronica and I are always here to assist you, as are the amazing design team that you can email or contact by phone. Now, any questions?
No questions. Thank you for that.
Beautiful. Adam, I'll hand back to you then.
Cool. Yeah, on the same notes as Rosemary, thank you very much for joining us for our first series. I hope you can join us tomorrow for our second one. The list of all our webinars will be on our website as well under events. We've also posted the resources link in the chat as well, so you can access that directly. Other than that, we look forward to seeing you in the future. Thank you all very much.
Thanks for your time, everyone. Bye then.